Cholera is an acute infection that occurs in the intestines when a person becomes infected. You can catch the infection when you consume contaminated food or fluids like water. As a result, cholera is linked to the environment and access to clean water. According to the WHO, the disease causes severe acute watery diarrhea, resulting in high illness and deaths. It can also spread rapidly, depending on the frequency of exposure, the exposed population, and the setting. Cholera affects both children and adults and can be fatal within hours of it being untreated. According to the WHO, over 1 million people were infected with cholera around the world last year. In Malawi, more than 18,000 people have caught the disease, while more than 16,000 of them have recovered. Cholera is an easily treatable disease. Most people can be treated successfully if they are treated promptly. So the question is, why have 620 people died of the disease in Malawi? Why has it not been brought under control as much as possible? Let's talk about this over the next few minutes here on The Square. My name is Keminni Amanor, and you're welcome. Joining our gathering are Dr. Queen Dube. She's Chief of Health Services in Malawi. We also have Maziko Hisbon Matemba, who is a health activist and Executive Director of Health and Rights Education Program. He's joining us from Blantyre, Malawi. And then we have Jobe. He's Executive Director for the Malawi Health Equity Network. He's joining us from Lilongwe, the national capital of the country. Gentlemen and lady, you're welcome to The Square.
Thank you very much.
Thank you very much.
Thank you.
I'll start with you, Dr. Dube. Give us a full picture of the outbreak in your country.
Thank you very much. So we reported the first case in March 2022 in the southern part of Malawi. Very, very unusual. We normally, years where we've had cholera outbreaks, it's predominantly been in the rainy season. But last year we reported a case in the dry season. We did get ourselves ready, brought it under control in that particular district very, very, very quickly. Unfortunately, last year, for the first time in 50, 60 years, we had two cyclones, Cyclone Anna and Cyclone Gombe, and that affected most of the southern region of the country. And of course, we had water and sanitation challenges in the southern part of our country. So it did spread to involve a couple of districts in the southern region, and was well confined to the southern region up until October time last year, when we started to report cases the rest of the country. And really, when you look at the Malawi data, things really actually rose very, very, very quickly. Immediately we had rains. So we moved from a situation where we had very few cases to a lot of cases within a short period of time with the onset of the rains. And of course, the moment you had it reported in every district in the country, that became a huge challenge. So the rainy season in Malawi onset is round about November time up until March, in other parts of the country up until April time. And so we are in the middle of the rainy season, and this is a time when we normally see an outbreak of diarrheal illnesses. So it wasn't surprising from our end to see a rise in the cases in the rainy season. What was surprising was us to report a case in the dry season.
And we'll try and figure out why you reported cases in the dry season. But first, as the WHO considers the number of deaths in this outbreak the worst in 10 years, what meaning have you drawn as a government into why there have been so many deaths this time?
So a number of factors, really. We've had a number of community deaths where people actually die at home. But one of the major contributing factors is late presentation. We also had issues with staffing and supplies at the very beginning of the outbreak. But you and I will know that cholera can kill somebody very, very, very fast. You just need a few hours of profuse diarrhea and vomiting for you to lose your life. And so what we've been doing as government together with our partners is really to engage our communities and encouraging people to seek care as early as possible at the very onset of the symptoms, and not to wait for hours and hours at home. So some of these cases, they get to our health facility, and within an hour or so, we lose the patient. For some of the districts where we've reported the highest number of deaths, we've had also a considerable number of community deaths, particularly in the cities where some people live alone and they start to have diarrhea and vomiting at night. They wait till the break of dawn for them to be present at the nearest facility. And by the time it's daytime, we've lost an individual. So those have been the major contributing factors. So really calling out for people to prevent as much as we can. But in the event that they catch the infection, to present very early at our health facilities.
Very well. I'll bring in Maziko at this point. Maziko, why do you think that people who may have these diarrhea-like disease or infection do not present early at the hospitals?
Well, I just want to agree with you, Dr. Dube, on what she has just mentioned. I think representation to facilities is a big issue. And the latest data, which we just seen this morning, more especially to do with how many people have died in terms of gender. We're seeing that more men are the ones who are dying more than women. We have seen that this is not surprising because I think late presentation by people going to the facility is a big problem. So issues is to do with people in terms of appreciating. And not surprising as well, even during the COVID-19, government provided vaccines and other innovations to make sure that people get prevented from COVID. But in terms of the community to appreciate the need to get vaccinated and to prevent themselves, I think it was taking a matter of more time for people to realize it is important. And I'm not surprised in this morning, I'm coming to get my jab, my cholera vaccine. When I went there were not many people in the facility. And I went around, I found some people who have just died out of the disease. And I was asking this question to myself to say, is it difficult just to get a vaccine, which government has provided for free? And it's not difficult, it's an oral vaccine, but people are not getting that. So it also requires a lot of things have changed over time. As Dr. Dube has mentioned, that over time, people haven't realized the importance of taking their own health in terms of making sure that they're hygienic, because we have seen even places where people live, for example, Blantyre and Lilongwe, where there are more cases than maybe the other district. When you go to the low density, to the high density areas, you find that people are just dumping out diapers, people are just dumping refuge, and even the water sources which they're supposed to take, maybe chlorine to make sure that it's safe. I think people are not doing that. So for me, where I'm standing, I think it's around personal hygiene. We need to find out what has happened for people not to observe hygiene practices, because before, people used to be wary of these diseases, because cholera is an old condition. It's not like a new condition which just started. In fact, history about cholera in Malawi is started in around 1973, which is about 50 years from now. And we still register each in out. But I think this year, as she has mentioned, starting of March, which is a dry season coming this far, we have seen registered more cases. So I think more is needed to find out why. It's about behavior.
Let's find out from Doc if by any chance they know why this keeps happening. Doc, you mentioned earlier that you were not expecting it in the dry season. You were expecting it in the rainy season, but it would seem that the rainy season only exacerbates the conditions in the dry season. So have you tried to understand why this personal hygiene-related infection continues to plague your country?
Yes, so the initial cases actually were imported cases, came in from across the border, and we managed the situation, but you know these borders are artificial borders, so we might not be in a good position to exactly say why it happened in the dry season, because the initial cases were imported cases. But one of the things that we also need to take to remember is the issue that climate change, the impact of climate change, we've seen that on a number of diseases. I just mentioned about the cyclones that wiped most of our southern region, and that's where the initial cases for several months were reported from. So issues around climate change, issues around WASH. It was just a matter of time when we had these really bad cyclones. It was just a matter of time that we were going to have something like this. But also, the other thing that we are seeing in the Malawi situation is that several of our districts, for 2 or 3 decades, they had not reported a single cholera case. And so when this happened, people were like, what strange disease is this? And of course, in an African context, people would explain things in their own way. And those brought up delays in them seeking care and also further spread of the disease. So just to highlight, is there an impact from climate change? Impact from the cyclones, the nasty cyclones that we had, impacting on WASH. But also, you know, when you look at WASH, for many years, we've had these terrible challenges within our cities. So we focus very much, you know, in the rural setting, where we make sure we have boreholes, we have rural water projects. But you know, in these informal settlements in the urban cities, we haven't really focused on places like those. And this is an opportunity for countries like Malawi to make sure that the informal settlements within our cities also have basic amenities like safe water and so on and so forth.
Very well.
Because when you dive deeper into the Malawi data, the 18,000, you will see that they're coming from specific areas. Even within the cities, it's specific areas. It's not the whole city. And these are informal high density areas, giving us an opportunity, as I said, to sort out the water and sanitation issues.
We'll talk more about the control efforts at this point, but let's bring George into the conversation. George, what would be your take on efforts by Malawian authorities to deal or control with the spread of cholera in the country?
There have been a number of efforts being put in place by Ministry of Health as well as the different stakeholders. As Dr. Dube said, most of the first cases were imported from our nearest country, a neighboring country. As such, I think at first people relaxed thinking that the disease belongs to that country. Probably that affected the people, their compliance to the information which was given. We have had posters and messages on radio and television, including in our newspapers. We have health surveillance assistants. These are community healthcare workers who move around, educating people. At least you can say people would become, would get information on cholera. But in some other cases, denial has been there. That is why Maziko has said, even at the moment when the cholera vaccination is underway, you'll find other people are still reluctant to get vaccinated. So we can say the efforts have been there, but as it has been said, and also as the cholera is, one must have information, and one must also practice the information. One must have amenities that are available. So for other people, for example, who did not have good latrines or toilets. For them, they needed to take action, especially in the cities, in some slums, where at a plot you would have more houses against a fewer toilets. I think there was need for action. So that required monitoring on what was happening. But answering your question on the efforts from different stakeholders to sensitize people and respond have been there. And one of the examples is the cholera vaccination we are seeing.
Oh, very well. Now, I want to come back to you, Maziko, and let's talk about the vaccine reluctancy. Why do you think people could be reluctant in getting the oral vaccine?
When I went around and also looking at the issues of vaccination, which I think George also do on most of the times, what we are seeing that, as you know, in 2022, we had a lot of launches of vaccine. We had COVID, we had polio. So there was so many misinformation which is going around by the different partners and others. Others were misinformation, others were just interested to share that information, but also the social media has contributed a lot. Because once someone lies negative stories about social media, some people, when they look at that, and we are not all that maybe aware on how to use social media, because people have used social media different ways. And most of the times, I think to us, I think social media has also contributed negatively to health issues, not only cholera, but also to other vaccination. Because we have seen the launch of so many vaccines in 2022, like malaria, but also there was the polio vaccine, but also there's this vaccine for cholera and COVID. So I think people could not appreciate, because COVID brought a lot of negativity on the vaccines. So that's why I'm not surprised when I went around, I saw that people are not as willing as to get these vaccines, even though it's been given for free. And it requires a lot of effort in terms of resources, more especially the community engagement, which has been mentioned by George, but also Dr. Dube, that we need to invest and continue investing, because we need to change the mindset. And the change the mindset cannot be done maybe in one time. You need to do it one more time. So I think change of mindset in different ways, I think that could be able to increase people. But when I was discussing with the district health office for Blantyre 2 days ago, when I was trying to find out what the things are going through, and I want to mention that in the last 3 days, you have seen the increase of people wanted to get vaccinated. Right. So it shows that these cases, we might see an increase of demand for these vaccines, but maybe the question now could be, do we have them, and how much? So
good question. Let's find out from Dr. Dube. Your country already received 2.9 million of the oral cholera vaccines. It's asked for more. Let's talk about vaccine distribution and availability. What is the state of that in Malawi?
So at the moment, we have about 200,000 doses left. And that, as you can imagine, with a population of 19 million, that's just a tiny amount. So what we've done, as you've mentioned, is to already start the processes of applying for another lot of vaccines. What you might be aware is the fact that we do have a global shortage of these cholera vaccines, because 2022 has been a very strange year in that most countries that have not reported cholera cases have actually been reporting cholera cases. So the demand for the vaccine has actually gone up. So we still await a favorable response from WHO, so we can actually vaccinate the rest of our at-risk population. But let me say that the mainstay of controlling a cholera outbreak is actually not vaccination. It's actually sorting out your water and sanitation issues. You can get vaccinated but still get the disease and have severe symptoms. So that's what we want people to have at the back of their minds. That
how is that going at the health services? Because then, as you rightly said, vaccines could give you a false sense of protection, and then you would get infected. So how are we dealing with the core problem of, the sanitation situation and perhaps unclean water?
Yes, we are. So For the two cities, the approach would be different from a rural setting where perhaps you're drilling boreholes and making sure that water is safe. But for the cities, what we have done is that particularly for the at-risk settings, to make sure that what we call water kiosks, some of them had been closed because of outstanding bills, to have them opened. For the schools, the reason why we've also had to delay the opening of the schools in the two cities by 2 weeks is to make sure that all the schools have access to safe water, making sure that schools that had outstanding bills and had their water supplies cut off, that's reconnected, availability of pot-to-pot chlorination. So our health workers have been moving household to household to provide chlorine, so that the water that they're using for drinking, for washing utensils, but also for cooking is chlorinated. So we're looking at short-term measures, but also looking at long-term measures. So that's what we're doing at the moment.
Very well. One of the things that Maziko mentioned is the fact that there's still indiscriminate dumping of refuse, as he has observed. What is the way out of that, particularly at this very important time?
So we've engaged our councils. So our councils, this is where you have your ward councillors, your politicians. We've also engaged our traditional leaders to try, because this one, we need the community to be on our side. Where to dump refuse, people know. Where to put up, say, for example, petra trees, people know. But for one reason or the other, they decide to go against what we've always advised. So that's why we're bringing on board the religious leaders, traditional leaders. So we sort out this issue together. And we've seen in some parts where our traditional leaders are so strong that we've started to see results already. So it's an ongoing issue, an ongoing conversation, ongoing engagement with our communities. It's not a one-off issue. We hope that as we continue with the conversations, we take advantage of the fact that there is this outbreak and there's an example that we can highlight as we're engaging the communities to sort out a problem that has been long-standing.
George, when we come back from our very first break, I want us to talk about treatment and vaccine distribution equity. So just munch on that. We'll be right back. Welcome back to the square. Today we are discussing cholera. The reason being that it's been recorded in a number of African countries, including Malawi, Burundi, and Nigeria. But our very special focus today is on Malawi, given the number of deaths in that country and the high number of cases as well. Still with me here are Dr. Queen Dube, she's Chief of Health Services in Malawi. Maziko Matemba is Health Activist and Executive Director of Health and Rights Education Program in Blantyre, Malawi. And then we have George Jobe, who is Executive Director, Malawi Health Equity Network, is joining us from the capital, Lilongwe. George, I was saying earlier, I want us to talk about vaccine distribution and treatment of the disease. As far as equity is concerned, one of the things that happen during situations like this is there is uneven distribution of preventive measures and treatment. What would you say, from where you sit, what do you see?
We look at someone who is in greater need to be given more than the one who is with less need. So we can compare the urban against the rural, who has more privileged the access to drugstores and the like. Those are some of the things. Now, let us come to oral cholera vaccination. The vaccination taking place now is the second round. There was another round. That was when the cases had just started and during the dry season. That time, most hit districts were around eight in number. And in terms of equity, those were the first districts that were considered for vaccination. We always participate in technical working groups that happen within the Ministry of Health and different stakeholders. We did support the 8 districts because they were critically hit. When we look at equity, we look at the less privileged, that they should be supported more. So the cholera vaccination happening now is the second round. There was a first round that targeted 8 districts. And it should be appreciated that there's an initiative here where we have an emergency operating center where, as a civil society organizations, we participate. And there are also technical working groups where different stakeholders, including the ministry, come in. We did contribute to the identification of the 8 districts that that time had been hit very hard. In the current vaccination, there are about 14 districts. These had high numbers by the time we received the consignment. So we can say the targets have been districts with the high numbers. Of course, at the moment, because of the limited stocks that we had, not everyone in the districts will be vaccinated, those who deserve. As Dr. Dube has said, we have about 200 vaccines against the high demand. At the moment, there is high demand in some other places, especially the cities. We have depleted the vaccines in some of the districts. But if we don't get the new consignment, we may have new districts, and if the spread continues, we may have other districts that are outside the targeted, and that would cause some challenges.
Very well.
If we were to, at this point, also provide some kind of advocacy, that is where the international community, including World Health Organization, needs to intervene so that the manufacturers should give Malawi priority. We need more vaccines. Of course, the message is still going to the people is that they should not relax when it comes to observing preventive measures, just relying on the vaccines. They should also be doing something. But at the moment, it has been focusing on districts with high numbers.
Very well. I want to come to you, Maziko, now. Considering that cholera has been around, particularly with Malawi, for a very long time now, what do you think are some of the long-term measures that the government could take in order to nip this in the bud, in that even if cholera should occur again this year, it would be very minimal as it was in 2019 and 2020?
That's a very important question. For us to, I think, as I mentioned earlier, that we have been having this cholera almost 50 years now, because according to history in the Ministry of Health, we have had this cholera since 1973. That is where the incident of cholera has been registered in the country. What we need to do is to make sure that how do we make sure that we take advantage of the lesson learned, because we can only get out of cholera when we have learned lessons and be able to do the right things at the right time. As Dr. Dube has mentioned, but also George has mentioned, we need to invest in primary health care. And primary health care and the cholera is one of the basic primary health care conditions which we ever had. So the question that cholera is not a new condition, it has been there almost for 50 years in the country. What we need to do is what are we learning out of what is happening at the moment? Fortunately, previously we didn't have the vaccines, but now we have cholera vaccines. But also we need to see what other environmental factors are affecting the upsurge of these conditions. And Dr. Dube has mentioned the climate changes and all those environmental factors, the cyclone, the floods, and all those. The question could be, what lessons are we learning, and what can we do better, more especially by making sure that everyone get involved.
Right.
Because the challenge with these things, if other people are left behind, or maybe they feel to be left behind, the challenge is they look at others to do certain things. For example, maybe throwing out of refuge in cities, in town, but also people building houses where there is no proper sanitation, but also they're using sanitation water sources which are not safe. Those things could be some of the things which I think as a country we need to move. We have stayed with cholera for many, many years. What we need to do now, lesson learned, We have new innovation in vaccines, which we didn't have before. Yes, utilize them. Of course, it's not 100% perfect, but at least we can get somewhere.
Very
But
well.
also, we need to encouraging continuous community engagement. Should not be a one-off, because most of the times we think once we have engaged, because we have seen in HIV, where the young people and men are getting more infections than virus than the others, because with time people do change, people do die over time, and the new people coming on board who might not be aware of some of these conditions.
I apologize for rushing us. I have just a few minutes to go. So I'll move on to Dr. Dube now. Dr. Dube, one of the measures that the country has taken is to close down schools, primary and secondary schools in Lilongwe and Blantyre. It's obviously faced some opposition from parents and private school association. But talk to us, what thinking went into that? Why didn't it cover universities, for instance? And really, why was it so last minute?
Thank you very much. So we're always guided by data. Over the past 7 days, we've seen a rapid rise in the number of cases in Lilongwe and Blantyre, particularly the cities. And as I mentioned earlier, one of the major contributing factors is water and sanitation issues. We were watching our data closely, intervening on the ground, and had hoped that perhaps the trend was going to be different. What we saw as we're going towards the end of December last year was that the trend was not reversing. And hence the decision that we had to make, painfully so, but safety always comes first. You can always have a student, you can only have a student in class if they're healthy and alive. And so our paramount aim as a Minister of Health is to make sure that even the students are healthy and their teachers are healthy and alive. Otherwise, there will be no school.
Very well.
And so we thought that we needed a few more days to make sure that basic WASH issues were sorted. We had primary schools in these cities that had outstanding bills and water had been cut. We needed to make sure that we've negotiated with our water boards to make sure that the water supply has resumed. We needed to make sure that sanitation issues were handled. And so you will see that the decision that we made, people might say it was a very last minute, but this outbreak has really changed over the past few days.
I see.
And for us, yes. And that's why, you see, for Blantyre and Lilongwe, we didn't say the whole district. We say the cities, because that's where the hotspot is. At the moment, the two cities are contributing nearly 50% of the cases. But when you zero in into these two cities, it's about 5-6 areas.
So the concern for the private school owners are the promotional exams, and you're wondering how students in the cities, as you have mentioned, will catch up. Is there a plan for a catch up?
There is a very, very clear plan. So when we were doing this, we had engaged with the Ministry of Education. So there is a very clear plan on how students from these two cities will catch up, so they don't lose out on the time. So there will be additional hours. They might end up with a shorter holiday during Easter. So we've factored in all those measures.
Very well. I want to move to the next. I apologize. I want to move to the next issue now. You're also engaged in surveillance efforts. I want to understand how you're working with your border countries. You know, your neighbors on your borders, Mozambique, Tanzania, Zambia. How are you working with them to ensure that, you know, this does not spread across the borders?
So we do have cross-border engagement meetings. This is something that has already been established. It got really strengthened during the COVID times. So we're using exactly the same mechanisms in our cross-border collaborations with Mozambique, Tanzania, and Zambia. But also we are planning to share data. So because we will be sequencing the Vibrio cholera. There are certain things that do not add up in this particular outbreak. So we're also sequencing this January. We will also be sharing the data with our neighbors.
I see.
So sharing scientific data, but also on preventive efforts.
Finally, public sector workers are threatening a strike. How do you see that impacting your efforts to control the outbreak in Malawi?
It's a big one, and we're keeping our fingers and toes crossed that the strike doesn't hold. But what we've also done, particularly in the hotspots, is to hire what we're calling temporary staff. So temporary nurses, temporary doctors, environmental people, so they can cover these districts within the rainy season. So we hope if the main civil service does go on strike, we have a backup plan with the surge capacity that we've just hired.
We'll see how that goes. All the best to you in controlling the outbreak in Malawi. Gentlemen, I'm so grateful for your company here and your insight on the matter. I hope that we meet again on better terms. Dr. Dube, your insight is much appreciated. Thank you so much.
Thank you. Thank you.
And
Always
to you
a pleasure.
watching us, keep safe. Be careful what you're eating. Make sure it's warm and you're washing your hands as often as possible. We did this during COVID. We can do it to combat cholera as well. My name is Keminni Amanor. See you same time here tomorrow.